Hello,
Welcome to Demo Go.
your guide to fundamentals of nursing practice.
Let's get started. Here's how it works.
Simple. You just have to select, watch, practice, and repeat. In this video, we will guide you in the assessment of vital signs. Assessment of vital signs: axillary temperature, pulse, respiration, and blood pressure. Please review the educational use and supervision disclaimer before using this material. Refer to this academic reference and copyright notice for details regarding sources and usage. Now, let's start. Presented here is an overview of the assessment phase, which will show the process that will be followed to evaluate the patient and gather the necessary information before performing the procedure. 1. Review medical record for factors that influence vital signs. 2. Assemble all equipment and supplies. 3. Assess body temperature for changes due to exposure to pyrogens or to extreme hot or cold environment. 4. Assess the client for the most appropriate site to check his temperature, pulse rate, and BP. 5. Ensure chest movement is visible. 6. Explain to the client what you are going to do, why it is necessary, and how he can cooperate. 7. Assess the client's feeling needs and proceed as appropriate. 8. Wash hands. 9. Provide for privacy. 10. Place the client in appropriate position. Moving on to the implementation phase. Here is an overview which will describe how the procedure will be carried out during the return demonstration. (11) Remove client's arm and shoulder from sleeve of gown. Avoid exposing chest. 12. Make sure axillary skin is dry. If necessary, pat dry. 13. Select correct thermometer. 14. Remove thermometer from storage container. 15. Cleanse with cotton balls with alcohol from bulb to stem. 16. If you're using a mercury thermometer, read thermometer by locating mercury level. It should read 35.5 degrees Celsius. 17. If the mercury level is not below 35.5 degrees Celsius, grasp thermometer firmly with thumb and index finger, and shake it up or down movement into the center of the axilla. 18. Place the bulb of the thermometer into the center of the axilla. 19. Flex client's elbow and place lower part of arm across chest. 20. Leave thermometer in place for 6 to 9 minutes or until it rings. 21. Inform client of the site at which you will measure pulse. 22. Support client's wrist by grasping over aspect with thumb. Place index, middle finger over the radial artery. 23. Identify, determine pulse, rhythm, and volume. 24. Count pulse for 1 minute by using second hand and watch. 25. Index and middle fingers should not be removed over the radial artery. 26. Observe 1 complete respiratory cycle. 27. Start counting at first inspiration while looking at the second hand of watch for 1 full minute. 28. Document respiratory rate, depth, rhythm, and character. 29. Document pulse rate, rhythm, and character. 30. Determine site most appropriate for blood pressure measurement. 31. Position the upper arm at heart level with palm of the hand turned upward. 32. Move client's clothing away from the upper aspect. 33. Make sure bladder cuff is fully deflated and pump valve closed. 34. Apply cuff snugly and smoothly over upper arm. 35. Place brachial artery. 36. Close valve by turning knob clockwise. 37. Inflate cuff to 30 mmHg above point where palpated pulse disappears. Slowly release valve, noting reading when pulse is first again. 38. Wait 1 to 2 minutes before making further measurement. 39. Cleanse the earpieces of stethoscope with alcohol or recommended disinfectant. 40. Insert ear attachment of the stethoscope into your ears in the appropriate direction. 41. Ensure that the stethoscope with alcohol or recommended disinfectant. 42. Place the bell of diaphragm over the brachial pulse. 43. Pump up cuff until the sphygmomanometer reads 30 mmHg above the previously noted diminished pulse point. 44. Slowly release the valve so that the pressure decreases at a rate of 3 to 5 mmHg per second. 45. As the pressure falls, identify the manometer reading of each of the 5 phases of Korsakoff sounds, if possible. 46. After the final sounds has disappeared, deflate the cuff rapidly and completely. 47. Remove cuff or wait 1 to 2 minutes before taking a reading again. 48. Inform client of reading. 49. Record reading. 50. Remove thermometer from the client's axilla. 51. Wipe thermometer with dry tissue or cotton ball from the stem down to the bulb. 52. Read thermometer at eye level. 53. Inform the client of temperature rating. 54. Shake thermometer down and place in appropriate container. 55. Record reading and indicate site. 56. Return all equipment in proper place. 57. Wash hands. Developed under the College of Nursing of the University of Riesel System, TETE, year 2025 to 2026. This video is a collaborative work of the following student researchers, in partial fulfillment of the requirements for nursing research. And that concludes our video. Thank you for watching. Explore more of our videos on the fundamentals of nursing practice on our website.